Thank you for the introduction and for the privilege of this podium to present our research on revision foregut surgery outcomes in patients with atypical and typical reflux. We don't have any disclosures. Revision laparoscopic anti-reflux surgery has been shown to be effective in reducing the symptoms of typical GERD. However, its efficacy in improvement of atypical symptoms continues to be debatable. This is due to a number of reasons, including the challenges in early diagnosis of atypical symptoms, as well as evaluating improvement of these symptoms after surgery. While some authors have shown no significant improvements in atypical symptoms after anti-reflux surgery, others have shown significant improvements in highly selective patients, especially in the improvement and resolution of chronic cough. Furthermore, there is a paucity of literature, paucity of data in the literature to show any improvement in atypical symptoms after redo foregut surgery, especially in the setting of recurrent paroesophageal hernia. So at our institution, we were interested in evaluating the differences in long-term quality of life, as well as perioperative outcomes between patients with atypical and typical presentation of GERD who underwent redo foregut surgery in the setting of recurrent paroesophageal hernia. So we performed a retrospective study of a prospectively maintained database of all patients who underwent redo surgery for recurrent PAH and symptomatic GERD between a 16-year period. We then divided this cohort into two groups based on their RSI score, and it has been shown that an RSI score greater than 13 is usually suggestive of atypical symptoms. So patients that scored a score of greater than 13 were assigned to the atypical group, and those who scored less than that were assigned to the typical group. We then collected demographic and perioperative and outcomes information, and as well as quality of life outcomes using the RSI survey. We performed univariate analysis to evaluate our data. 133 patients were included in the final analysis, and the two groups were similar in age distribution, BMI, gender distribution. However, they did differ in the distribution of ASA score. The typical group also were more likely to present with a type 3 hiatal hernia and required an esophageal lengthening procedure in addition to a complete or partial fundoplication. Both groups actually had a similar length of hospitalization after surgery. Besides an increase in 30-day readmission rates in the atypical group, the two groups were parallel in terms of wound-related or non-wound-related complications. And after an average follow-up of about 30 months, the two groups had similar rates of recurrence. In looking at quality of life outcomes, the RSI group did report a lower RSI score at both baseline and latest follow-up. However, the percentage improvements between both groups were similar. But the atypical group required long-term use of anti-reflux medication, but typically this was done at a lower dose. So in conclusion, our results showed that patients with atypical symptoms of GERD, as defined by an RSI greater than 13, and recurrent PAH may benefit from revision foregut surgery with improvements in quality of life outcomes and no increased risk of perioperative complication, which is comparable to the typical group. However, we know patient selection is key to optimal surgical outcomes, hence future studies are needed to better diagnose and define patients with atypical presentation and also to evaluate their response to redo foregut surgery. Thank you.
Thank you. Any questions?